Hey guys, what's going on? Dog and I hope that you're having a great day. And I just wanted to speak a little bit about the fact that research catches up to alternative medicine, not the other way around. So let me get straight to the point. Acupuncturists have known for a long time that specific methods, like in this case, moxibustion, which is a burning herb that you put above or on the skin or on the needle, can, in our words, tonify blood, tonify. That sounds pretty cool word. Maybe hashtag tonify. Start using that, please. So we've known that we can tonify blood or enrich blood using specific methods, right? And it wasn't until recently that the proof started to surface in a way that's satisfactory for the Western medical community. Now, this is what really gets me. This is a very polarizing kind of opinion, right? Traditional medicines work, and they work. We know that they work because we've seen the manifestations in clients. A client who has low white blood cell count, confirmed by a blood panel, who's receiving chemotherapy. It's critical that white blood cell count remain above like 1.5, I think it is. Someone who has an autoimmune disease may have a high white blood cell count. It's critical that white blood cell count be attenuated to the needs of the body, and we can do that using methods like acupuncture and sometimes nutrition and moxa. But before the research came out on the effects of acupuncture, moxibustion, and white blood cell platelet count, et cetera, there really was no acceptable proof. And this research also is not very well known among medical doctors. So you walk into any primary care physician's office, they will never have heard of this research. But the point is that we know that these methods work, and it's a kind of a small sliver of society that will trust us when we say we believe or we know that this works because we have seen it, but we don't have any research. Let me just give you an example of the research, okay, to show you how new this is. So here's an article from 2020, a research article from, I think, March of 2020, and it measured the effect of moxibustion on patients who were in chemotherapy. What they were looking for was what they call gastrointestinal reaction. So they were trying to measure the amount of nausea that patients had during chemotherapy. It's moxibustion in the prevention of nausea and vomiting induced by chemotherapy. And that's like nausea and vomiting are really, really detrimental, really serious for chemo patients, because it's so toxic, it really exhausts you, right? I mean, I've seen people, including my own father, sleep for over 24 hours after a dosage of chemotherapy. So the ability to eat and to restore your body's energy is critical to your survival, right? So nausea and vomiting are taken very seriously. There are some Western drugs that they have now which do a great job of quelling nausea and vomiting. But as it turns out, moxibustion is actually more effective than those, and that's a separate study. So what they found was that the gastrointestinal reaction degree in the group that received moxibustion was much lower. So the reactivity of the GI tract to the chemotherapy was lower. There was less nausea and vomiting in those who received moxibustion. However, they also found that the platelet count and the white blood cell count in the observation group, in the group that received acupuncture and moxibustion, was higher than in the group that did not. This means that acupuncture and moxibustion not only, I keep saying acupuncture and moxibustion because that's how we do it. It goes together. But in this study, it's not acupuncture; it's moxibustion only. This means that moxibustion in chemotherapy patients not only reduces nausea and vomiting, allows them to eat and keep food down more easily, it also raises white blood cell and platelet counts. And in addition, the patients reported that their quality of life went up. These are, moxa should be part of your recovery routine. If you're getting chemotherapy, if you have cancer, if you have Lyme disease, if you have rheumatoid arthritis, you should be getting moxibustion at least once a week. And I advocate for you doing it for yourself at home. I show my patients how to do this. Very few of them do it. but that's another story. But you can do this at home. I do it on myself at home. I do it on my kids, and it's really effective, and it works no matter who does it to you. You don't need somebody with experience to do it. You can do it yourself, and it will work just fine. But you should be getting something like Moxa in order to support you through the highly toxic, highly deleterious process of chemotherapy. And that's why most people do it, because they don't want to stop the chemo. They don't want to repeat the chemo. They don't want to have this experience more than they absolutely need to in order to be well, in order for their cancer to go into and stay into remission. But it's a really, doctors really like to disrespect us. And they really like to disparage us and negate, just straight up talk to their patients and say acupuncture can't help you, it doesn't do anything, and they don't know. They just don't know. And the patients, they're not going to question that. And the nail in the coffin is often when the doctor says, well, I haven't seen any research on acupuncture or burning herbs affecting white blood cell count or nausea or anything. Just take the medications and do what you're told. If there's no research, then there's no definitive proof. But for me, I never needed research to have definitive proof. For me, the proof is, how do I feel? How does my body react? Not always how do I feel, because you can't feel your white blood cells, for example. But you sure as hell can feel it if you have to stop chemo and restart the whole cycle again, 4, 5, 6 months later. So the proof for me has always been in my body's response, or the response of the body of you guys, the patient. And if you look at most research articles on acupuncture and moxibustion, they're inspired by what people are seeing in clinic. Like I said earlier, we've known from our use, from our clinical observation, that acupuncture and moxibustion builds blood. That's what it does. That's how it's described. We've known that for hundreds of years. In some cases, thousands of years. I'm not sure how old acupuncture and moxibustion in its present form are. I think it's a little bit less than 100 years old in its present form. I can tell you that they weren't using silicone needles and stick-on moxa 2,000 years ago. I know they weren't using silicone-coated needles and red light therapy and all that kind of stuff and stick-on moxa 2,000 years ago, because it didn't exist. So we've known this for a long time, and it can be very, very polarizing and controversial and impossible for us to prove. It drives me nuts when we make statements like, we can help you with your anemia. Acupuncture and moxibustion can help raise your white blood cell count. We can help to enrich your blood. We can keep you in chemo without having to drop out. And patients, before they spend a dime, they need to know, some of them need to know how. How does it work? And I can't explain it beyond the Chinese medicine terms. Even these research articles don't explain it. They just know that there's a before and an after in the white blood cell count, and the group that got the moxa had higher white blood cells than the group that didn't get the moxa. It doesn't explain how it works, but we know that it works. So polarizing, controversial, frustrating for me, maddening for me sometimes, to know that something works, but the research just isn't out there showing that it works. And often there's also no information, no research showing how it works. Interesting, don't you think? Of course you do, don't you? Okay, thanks for watching.